Hi, Dr. Tracy, board certified general pediatrician, and let's talk sleep training in infants. So, this is a really hard topic, and I struggle sometimes approaching this with parents in my office because it can often elicit an emotional response. And I understand sleep training my children was probably one of the hardest things that I did until the next phase of parenting. But it was really hard. It was emotional. I spent a lot of time crying. My husband and I didn't agree on how to do it. Both my kids needed really different sleep training techniques. We made a lot of mistakes. We did a lot of things right. And lo and behold, they're just fine. So, what does the actual evidence show about sleep training in kids so that you know what's the best way to sleep train your child if you want to? So, first of all, there is really good scientific evidence based data that sleep training your child after the age of 6 months has no long term effects on their health in a detrimental way. It doesn't harm them, is basically what it means. They checked cortisol levels, they looked at bonding, emotional attachment, psychological parameters for up to 20 years in some cases, and found that it was completely safe and in some ways protective if the child had sleep training after 6 months of age. What they noticed also was that in parents, they had overall lower levels of cortisol and happier demeanor in general if they sleep trained their children after the age of 6 months. So basically, is it safe? Yes. Can it be effective? Yes. Do you have to do it? No. It is totally a parental preference. There's a few techniques that do have evidence behind them, so that can be helpful to talk about. The first one is the cry it out method. I know everyone hates this one, and it's not for everyone. It's not for every child. It's not for every parent. It's not for every situation, but it works. It is scientifically backed, it is effective, and it has not been shown to harm your child. So if you end up trying everything else, and you have to use the cry it out method, you are not a bad parent. You are a great parent that is following scientific research. If you decide not to do it, that's okay too. Other methods are really working on your child's bedtime routine. So if your child falls asleep on their own after 6 months of age, they are so much more likely to be able to fall asleep on their own throughout the night. So this is having a specific routine. You feed them in the same place every night. You do the same thing. You wrap them up if they're little. Otherwise, you get them all cozy, get them sleepy, but lay them down awake. Let them practice falling asleep on their own. You can pick them up at a scheduled time if you want to. You can have whatever schedule feels right to you, but keep working on getting that child comfortable falling asleep on their own. This has been one of the most effective ways that has been studied, and I've also known in my own practice can help parents get better success in the middle of the night. So that's something easy to do. Another thing is a technique that I like to discuss, which is after that 6 months of age, and you can do it a little before, but we'll go by what the studies show. After 6 months of age, if your child wakes up in the middle of the night, they don't medically need food. It's okay to breastfeed them or give them a bottle. I'm not saying it's not, but they don't medically need it for growth, maintaining their blood sugar, any of those things. So if they wake up and it's been less than 6 hours, you can give them 15 minutes. You can go get them if you want. You can swaddle them up and cozy them, rock them, and do whatever you can. Change their diaper if they're wet, try to put them back down. If after about 30, 45 minutes, they're not going back to sleep, feed them. Do that for about a week and then push the time out a little bit more and then push the time out a little bit more. Get the child used to the idea that I don't immediately get fed every time I wake in the middle of the night. But if they're not going back to sleep pretty easily, they might be hungry. So certainly we don't want to withhold food from them. So that's another technique that you can use to kind of slowly get you and your child. Sometimes it's us. They would be fine without the breast or bottle, but we're so used to soothing them that way that we automatically go to it. And sometimes it's changing our mindset too. Scheduled sleep awakenings is also something that is scientifically backed, which can be helpful. So you deciding when your child wakes up and then you starting to space that out. So this would be a situation where you say, okay, at 3 hours, I'm going to wake you up, I'm going to change your diaper, offer you food if you're hungry, put you back down. And that then you can start to stretch that time back out. The child will get used to you waking them up as opposed to them waking up. And then when they wake up, they're like, oh, this isn't time for me to feed because they didn't come and get me. There's some other techniques as well, and I'll link the article down below so you can read it for yourself. But I just wanted to give parents some support of those that are thinking about doing some sleep training because they're exhausted, their baby's exhausted. It affects everybody's health, everybody's moods. It's so hard for families to not get any sleep. I wanted to empower you that it is safe and effective. You have science behind you. I've been doing this for over 20 years. I've never seen it cause a problem with a child, but I have seen no sleep training of any kind have a really negative impact on children and the family. So I hope this helps a little bit. Again, I'll link some evidence-based articles below so you can take a look for yourself. And if you have any really great techniques that have worked for you, as long as they're safe sleep, feel free to mention them below in the comments. Take care.